I'm Dr. Zahraa Al-Shamary and I work between two practices in Exeter at the moment, in Devon. 2 days in one, 3 days in another. I was working 4 days before and now I've gone up to 5. And I can do Saturdays when I wish, really, when it suits me and my boss. I was working in an independent practice for about 18 months and then started working for IDH on a locum basis. Did that for a few months and then started a regional role. So I worked across many practices in Devon, which was brilliant because I got to see lots of different practices, work with lots of different teams, and then a couple of positions arose in Exeter which suited me fine, and I'd worked there before. So yeah, just took them really, and I've been working in between those two now for a while and I'm loving it. Well, yeah, working for IDH, you've got so much support and there's many practices, so any change of circumstances you get to move across within the company, and the support you get on a practice level but also nationally means that you can just focus on dentistry really. Working for IDH means that you can just focus on your dentistry. I go in to work in the morning and I come home at night and that's it. I don't need to think about anything else. If there's anything I need doing, I can ask my practice manager, my practice support manager or my lead nurse, and it gets done, and then that's all I need to think about, my dentistry, so I can focus on patient care. Within the last 12 months, the academy's opened, which offers courses, hands-on as well as lectures. So it's a short trip from home, from Exeter, to come and make use of some amazing facilities here. And I don't know where else you can get this sort of support in which other profession, but it's brilliant because it takes a lot of the pressure off trying to organise trips and look for courses. IDH do that for us and we just need to pay and attend. But it's great because you do actually get to see a lot of the same maybe faces that on other courses. When you come back to the academy, you'll a lot of the colleagues do go together or just meet up when we get here, and it does just make it a little bit easier to keep on top of CPD. So I was thinking of taking up an MSc, but it was getting quite difficult to choose and to organise how to take time off work. And then on the app that we've got on our computer at work, there was a pop-up to say that IDH itself was organising its own cohort, which meant that if you sign up, if you get a place, it's structured from within IDH itself and has taken a lot of the stress of trying to find a suitable MSc, and it's organised by the company, so you just attend and it's done for me, which is brilliant. I get a lot of support on a local level as well as nationally from the company. If I ever have a problem, I just speak with my practice manager. But also there's so much available within the company in terms of courses and how I can progress further. So the support I get just helps me to focus on what I was trained to do, and that's dentistry. I come in the morning, I see my patients, I do what I need to do, and then I go home. But also, if I want to develop any of the skills that I want to focus on, all I need to do is send an email or pick up the phone, and there's somebody somewhere that will help me focus on that. I think I'm very lucky. The practices I work in, because I'm between two, I've got many clinicians around me all of the time. It's far from being a lonely profession. And it's brilliant because I've got clinicians of all various ages, experience and backgrounds. So you're always learning from them. If you're willing to learn, you can talk to other clinicians just within the practice, or obviously peer reviews, which we've started to do in the practices where I'm working. But also, when you do go to courses, like I say, if you go into local courses, you see the same clinicians maybe. If you go to the more sort of central courses like in Manchester or in London, then you're seeing even more clinicians. And then that's when you know this is a huge company, there's a lot of support there, there's various different clinicians who've got so much experience, and collectively it's just giving that patient care and being able to offer and refer through networking, really.